Good morning. Mr. Sonam Wangchuk, who has been fasting for more than 20 days now, today would have been the 21st day, has been shifted to Safdarjung Hospital early this morning. I wonder why, because Loya Hospital is barely a 10 minutes drive or maybe even less from Jantar Mantar, where Mr. Wangchuk was doing his fasting. Now, the question is that what will the hospital personnel in Safdarjung find in Mr. Wangchuk's case? Now, keep in mind, this was not an intermittent fasting. This was actually prolonged fasting and continuous full-blown fasting, which means that by now he must have hit a starvation status, and therefore the doctors in Safdarjung Hospital will find that his heart rate would be on the lower side. It could be as low as in the 60s or even in the 50s. There is a possibility that the heart rate could have been reduced to the 40s. Apart from this, the systolic blood pressure would be again lower than normal. It could be in the 90s, it could be in the 80s. The diastolic blood pressure would be low. The blood glucose would certainly be quite low. The blood ketones would be high, would be almost 5 to 6 millimoles, and uric acid would also be on the higher side. The urea would be on the higher side. Now, the important thing to keep in mind here is that crucially, his immunity would be on very much lower side. This is because of the starvation, no proteins, no vitamins, no minerals, and therefore the T cells and the B cells would be sluggish. And apart from this, we have this brilliant study which was published in 2023 in a journal called Immunology. The study was so nice that there were two editorials or perspectives published in two different journals, two different science journals. One is called Cell and the other called Nature. Now, this particular study was done by Janssen, and this showed that this was of course done in mice, not in humans. And when the mice were deprived food, that is, they were fasting, it was found that the monocytes, which are the first responders in the event of an infection, the earliest responder, of course, is what is called a polymorph. The second responder is the monocyte. The monocyte, when it reaches the focus of infection, transforms into a macrophage and swallows up the virus or the bacteria or any debris, and then starts communicating this to the immune system in the body. Now, this study showed that in mice that were fasting, the monocytes plummeted in the bloodstream. There, in fact, were no monocytes to be seen, and this was surprising. But the hallmark of the study was that the researchers found that the monocytes actually migrated to the bone marrow, and here they sort of went into some sort of a hibernation. And when these mice were refed, then these monocytes came out back into the bloodstream. However, these monocytes now were not capable enough to tackle an infection. They in fact induced a bacterial infection, and this was the bacteria Pseudomonas in some mice, and found that the cells which had migrated into the bone marrow and had now come back into the bloodstream were not as effective as the regular monocytes, despite the fact that the numbers of the monocytes had increased. Now, what is the practical implication of this study? The practical implication is that during prolonged fasting, your immunity will go down, and this means that you become more susceptible to infections, particularly virus infections. And currently, India has about 3 virus infections going around, and these are present in Delhi also. You have influenza A, the virus H1N1, the swine flu virus, and of course the COVID virus. Apart from this, of course, if a person is compromised where his immunity is concerned, he becomes susceptible to tuberculosis. I am highlighting this fact that when a person fasts for many days, at a time, not your fast for a single day in a week or 2 days in a week, but a continuous fasting for about 15, 20, 25 days, then your immunity gets compromised and you are certainly more susceptible to infections. And this point is very important to remember, because I saw a photograph yesterday of a politician visiting Mr. Wangchuk and touching his hands or shaking his hands. This is a big no-no. In future, the doctors around Mr. Wangchuk must keep in mind, they must have a protocol in place that ensures that no one touches Mr. Wangchuk. Yes. And this also implies that when a few young men support him while he walks to the washroom or to the toilet, they ensure that they themselves are not sick, that they do not have a sore throat, congestion or fever. Because if they are carrying an infection and if they touch Mr. Wangchuk, they are bound to transmit this infection to Mr. Wangchuk. I don't know what will be the protocol in Safdarjung Hospital, but this is what one should keep in mind. The second angle to Mr. Wangchuk's fasting is that invariably the heart gets affected, and this can be dangerous. I've already mentioned that the systolic blood pressure comes down, the diastolic blood pressure comes down, the heart rate comes down, but apart from this, the most dangerous aspect of prolonged fasting is the fact that the QT interval gets prolonged. Now, I don't want to make this complicated, but when the QT interval on the ECG is found to be more than 550 milliseconds or more than 600 milliseconds, then the chances of a dangerous arrhythmia arising become very high. When the QT interval is more than 600 milliseconds, then that can trigger a ventricular tachycardia, which is called the torsade de Pointes, and this can be fatal. So therefore, the attending doctors must keep in mind that from now on, an ECG must be done twice a day to pick up this prolongation of the QT time, which is actually the repolarization time of the heart. Now, apart from this, the ECG can also show a flattening of the T waves, inversion of the T waves, and also depression of the ST segment, indicating that the heart is being damaged because of the fasting, because of lack of nutrition. Now, the QT interval prolongation can be either because of direct assault to the heart because of lack of nutrition, or because there is electrolyte imbalance, in the sense that the potassium levels go down as also the magnesium levels go down. So therefore, if a medical intervention is done, then the first thing to be done is to ensure that the potassium and the magnesium levels are maintained in the normal parameters. Now, what should be the approach of the government? My personal take is that the government must change tack. It must become more magnanimous, more charitable. There should be more empathy, more sympathy because ultimately Mr. Wangchuk undertook this prolonged fasting because of the fact that at least 12 young innocent children committed suicide. Now that is a matter of shame. It is a very sad event because there was a leak in the NEET entrance examination. Now the leak was organized, and this leak has been going on for the last so many years. The Chinese also have an entrance exam, and this is called the Daogao. Here almost 12 to 13 million sit this exam, which means 120 to 130 million children sit, and never has there been a leak. Of course, there is cheating, and when the culprits are caught, they are punished severely. They are jailed. Some have been jailed for as long as 7 years, but there has never been a leak. The NEET exam is sat by almost 2 million, that is 20 lakh people. And apart from this, there is the engineering entrance exam, wherein about 1.5 million children sit, that is 15 lakh children. And apart from this, of course, you have the UPSC examination in which about 5 to 8 million people are appearing. That is about 50 to 80 lakh people are sitting the exam. And there is no guarantee that there have been no leaks in the engineering and the UPSC competitive examination. So therefore, the answer or the approach, the strategy which the government could adopt is quite simple. The demand has been that the education minister resign, and that in itself is not a very big deal. Surely the Prime Minister, in his infinite wisdom, can make a reshuffle, and in this reshuffle, the education minister can be displaced. He could be given some other responsibility, maybe not in the cabinet, but India is a huge country and there must be many opportunities, there must be many slots for him to take over. And with this, I will end this video, and that is Mr. Wangchuk should be warned that his immunity now is very low, and therefore he has to beware of infections, whether by a virus or whether by bacteria. And the other thing is the doctors looking after him must ensure that the heart is in a stable condition, that the QT is not unduly prolonged, and we must keep in mind that the commonest cause or the commonest causes of QT being prolonged are either a fall in the potassium or magnesium levels or a drug-induced event. Thank you very much.